Good evening, everybody. I'm Sayukta, your host for today's live from All About Skin Allergy team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their life. Urticaria is characterized by round rash that itch a lot. It may be due to chemicals in certain food items, allergy to certain medication, insect bites, sunlight, and even sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self medication can worsen these symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So today we have with us dermatologist Dr. Priyadharshini K, who is a dermatologist and general physician in Alagapuram, Salem, Tamil Nadu, and has an experience of 5+ years in this field. She practices at Dr. Priya's Radiance Skin, Hair and Nail Clinic in Alagapuram, Salem. Dr. Priyadarshini will educate us more about urticaria and its management. A very good evening to you, Dr. Priyadarshini.
Very good evening, Ms. Sanyukta, and very good evening to one and all.
It's a pleasure to have you with us, Dr. Priyadharshini, today for this session. And today we are going to talk about a very important topic, urticaria and its management. So, Doctor, first of all, we would like to understand what is urticaria?
Okay, so urticaria means it's an inflammatory skin disorder. What you will see in a patient with urticaria is patient will be coming with a lot of reddish, itchy lesions all over the body. And below the skin, what is the main disease process which is going on is the inflammatory mediators or the inflammatory neurochemicals which has been released in the body because of some mismanagement in the inflammation pathway. So basically, it is an inflammatory skin disorder which will be associated with intense and severe itching.
Right. And doctor, why it happens? What causes urticaria or what triggers urticaria?
Actually, if we go back and see what are the cause, what could be the cause? Actually, before going to the cause, we have to know the types of urticaria, because usually based on, as you said in the introduction, based on the time of occurrence, if it is less than 6 weeks from the onset of urticaria, it is called as an acute episode of urticaria. And if the duration of urticaria is more than 6 weeks, then it is called as chronic urticaria. And if you find any clear trigger, such as cold weather or sun or any cholinergic symptoms which produces urticaria, or even a pressure applied on the body can produce urticaria, or some drugs, some medicines can provoke urticaria, food can provoke urticaria. All these will come under inducible urticarias or physical urticarias. In sometimes, without all these causes, a person may have urticaria because of their own genetic predisposition or because of autoimmune mechanisms. So in such a case, without having a proper cause only, the patient may have urticaria. So mainly in case of inducible urticarias, the causes which I have told, all the medicines, food, stress, all those cold weather, all those will be the cause.
Okay, so n number of things can cause urticaria, and as you said, doctor, there could be acute urticaria, it could be chronic. Now, with what you said, I can understand that acute is what doesn't, stay forever with us. It will go away, or the treatment will work once we have been able to diagnose the trigger or the cause. Is that correct? Diagnosing the trigger or the cause is important?
One more thing in acute urticaria is the patient will be having his first episode first episode of urticaria, which is like the onset will be sudden. That is called as acute urticaria. So these acute urticaria patients only will convert, like half of the patient will get converted to chronic patients of chronic urticaria.
Okay, fair enough. And doctor, as you said that urticaria is like red rashes, it itch a lot. But what happens, as a layman, for us, skin allergy is having rashes on our skin, and of course, those rashes will itch a lot. Now, if as a layman, I or my viewers want to, differentiate whether this is urticaria or any other skin rash, how can we do that? I mean, how does urticaria look like exactly? And so we can say it's kind of an allergy. Can we say that?
Yeah. Usually, like urticaria in layman term, they say as allergy, but allergy includes other like skin conditions also. But for a layman or for a normal people to find urticaria, you have to know certain things. Usually, the lesions of urticaria will be thick, and you will see your skin has thickened in some part of, like where the urticaria is there, and it will be intensely red, and you will have like very severe itching will be there. And apart from that, the patient will be having like multiple red small lesions will be there, and in the ears, mainly in the ears and in the face, these urticaria lesions will occur. And main important thing regarding urticaria is patient will be having, along with urticaria, some patients will be having swelling of the face, especially swelling of lips and eyes will be there. So with this symptom only, we can find out that the patient is having urticaria. And one more important thing you have to remember is it will go like on its own after some point of time, and again it will come back. So when you like when the patient is having this symptoms which comes by itself and goes by itself, and with this all these symptoms, then it might be urticaria only.
Okay. Now, doctor, we can now understand that, urticaria can actually hamper the quality of our life because one who is suffering from it is continuously itching. The amount of discomfort, de-stress that a person is going through is unimaginable. Now, my question is it just that it hampers the quality of life, or is it a serious disease or disorder or condition? How serious can urticaria be?
Okay. Usually, what happens in urticaria is uh, there is some trigger which is there. Either like without any trigger, also the patient may have urticaria. What this trigger exactly does is it triggers the cells which releases some cells in our body which releases some chemicals, some kind of chemicals. So these neurochemicals or neurotransmitters or these chemicals will produce this each creating cells in our body, and because of intense itching, this symptoms and all will happen. In 50, I told you that in 50 percentage there won't be any cause. So in such case, the patient will be having on and off symptoms. This is like normal. The patient will be telling, I am getting urticaria once in a week or something like that, and after that the patient will be having like they won't be having any complications. But in 30 to 40% of cases, mostly it will be associated with other autoimmune conditions. So like thyroid autoimmune thyroid disorders, or Hashimoto's thyroiditis, or other autoimmune conditions also, there can be association. And sometimes what happens is, I told the swelling of lips and eyes will be there. That is called as angioedema. This peculiarly when urticaria is associated with this angioedema, this causes swelling of the respiratory tracts inside the system also. In such case, if you don't treat such condition, the patient will be landing into like a shock, and it can affect the life of it can cause the life of the patient also. They can land in like severe complications. So in such a case, urticaria is very important that we have to treat it. Otherwise, in chronic patients, it won't affect much of their systemic cause. The systemic involvement won't be there, but it affects the quality of life, as you said.
Right. So in both the cases, even if it hampers just the quality of life, or it reaches to a level where a person can choke, etc., it's always advisable to go and contact the right person, take advice from the right person, which is a qualified dermatologist in this case. So viewers, please don't keep suffering in silence. Okay, it's a disorder, but it has a treatment. You will get relief. Plus, don't waste your time in over-the-counter medication, self-medication, or home remedies, etc. Please go and consult your doctor because you will get relief at as early as possible. Now, doctor, when I said that, as you said that in chronic, most of the time the reason or the trigger or the cause is not known, and chronic is something which have already crossed the time duration of 6 weeks. Now my question is, because many a times patients, especially those who have chronic urticaria, keep asking that will it ever go away permanently? Is there a permanent cure for this? I am sure you also have patients asking the same
Yeah.
question. What's your answer to them?
This usually this chronic urticaria affects the quality of like patients' lives to an extent that patient will leave the job. They will have problems with in their house, and they will have a lot of personal problems, and later it will affect their mental health also. So in such a case, patient would be almost in tears when they discuss about their issues, chronic urticaria, itching, and all with the doctors. So in such a case, like to all patients, what we say is 10% of chronic urticaria patient will go into remission in 1 year, 50% in 5 years, and almost 75% in 20 years. But if you look at the duration, 20 years, 75% will anyhow will go into remission. But within the 20 years, patient has to suffer with this episode. So they have to take treatment, proper treatment in those 20 years to avoid all the sufferings.
Right. And doctor, what are the potential complications of urticaria if left untreated?
Okay, so this I told you in the pathophysiology or the mechanism behind this urticaria is that those neurochemicals which has been produced by the body is we can suppress that by giving medications. If they are not going to take it, those neurochemicals will be continuously produced in the body, and the patient will be having a lot of urticarial episodes, and the patient will be having always itching will be there, and it will be more symptomatic if we are not treated the urticaria. And if they are having angioedema, it can be life threatening also.
Right. So again, it's always advisable. In fact, the whole, purpose of having this session is to educate and aware our viewers that how important it is to go and consult the right person, and also about what is urticaria. Because many times, people don't know, they don't understand, and they keep on suffering. So it's important to tell them that, see, there is treatment. Even if many times if the, cure or the complete treatment takes a lot of time, but at least you will get relief. So don't suffer in silence is what we are continuously trying to convey to our viewers. Now, doctor, as you said, you get patients who have left their job or whose family life is suffering and they are into a huge stress. And we can actually understand a person who's continuously itching, who's going through this trauma. I mean, how much of discomfort, distress the person is in. It definitely it causes stress. But can urticaria be caused by stress? And B, can stress aggravate the urticarial, condition that a person is already having?
Okay, this is a very nice question that you have raised. Actually, stress is one of the important trigger factor for urticaria. So it's like a cycle of what to say, cycle of mishappenings. One thing leads to other.
Vicious cycle,
Vicious
one
cycle.
leading, yeah.
Yeah, one thing, the stress leads to urticaria, urticaria leads to stress. So it forms a cycle then. So it's very essential for patients of urticaria to avoid stress in their life, to avoid the further episodes from happening.
Right. So when a person comes to you, because you have already said, especially with people who are going through, chronic urticaria, they many a times when they talk to you, they, have tears in their eyes because for whatever trauma they are going through. Now, do you feel that mental conditioning or, counseling is equally important in the treatment of urticaria? Okay, medical treatment is one point, but then mental counseling is also important.
Yeah, true. Main thing what they have to understand is it's going to be there. Urticaria is going to be there in their life. Most of the people, around 90% of people come to a dermatologist for treatment of urticaria, that it's going to go like other conditions, it's going to go in some months or something like that. But they have to understand for other chronic lifestyle diseases like diabetes, hypertension, this is a similar disease in our dermatology. So they should understand that it will be there in their life. If it goes, then they must be feeling satisfied, but otherwise, this they should understand that this is a chronic disease, and acceptance that this will be there and I should get treated when it is getting severe. All the education part we should do mental health counseling for them for to treat urticaria properly.
And as you said, doctor, that for example, a patient who is diabetic or a patient who have hypertension or blood pressure. Now, of course, it is going to be there forever, and they'll have to take treatment or medicine, etc., whatever they are doing forever. So the same as with chronic urticaria. So people should take it that way. That okay, we have this, but then we have treatment as well. The only need we need to do is to go and consult the right person, which is a qualified doctor in this case. Now, doctor, we would also like to talk about the treatment part. How, as a dermatologist, you treat urticaria?
Okay. As I said earlier, when a patient comes to us with the symptoms of urticaria, first we will ask them whether they are having their first episode or he is a chronic case. Usually, this acute urticaria cases, I told you, no, the first episode, less than 6 weeks duration, all those will be like the major age group will be kids and babies. So in such a case, mostly any giving parents would have given any new medicines for their infections, or they would be suffering from any cold, cough, flu, or something like that, or even an insect bite, sting bite, or all those can precipitate urticaria in such cases. So, in such case, you have to just eliminate the trigger and just if you treat it, if you treat the patient, if you give a short-term treatment, then they will be okay. In chronic urticaria, I told you in 50% of cases, they will be associated with other trigger factors. So we have to rule out all that, and we have to take few tests to see their thyroid levels, they are okay, and other triggers, other causes. If they are not having anything, we will be labeling them as chronic spontaneous urticaria, and we will be treating them with the medicines which will subside the allergy producing chemicals. So,
Right.
yeah.
Yeah. And doctor, I'm having a few viewers who are also asking their questions. So Atimina is here asking, ma'am, in pregnancy, sometimes urticaria occurs. Which medicine you would like to suggest in this condition?
Okay, so pregnancy and urticaria is a very complicated thing because many patients will have their first episode of urticaria in pregnancy only. And usually these allergy producing chemicals will be in high levels all throughout their pregnancy. And treatment part, many of the medicines which we are giving are not safe, mostly studies are not there. So few, only 2 or 3 medicines we will give, which is labeled as safe for throughout the pregnancy. They can consult their nearby certified dermatologist to take such safe medications only. Only one thing they have a pregnant patient should remember is they should not take any medications for urticaria herbal or anything, because or the unlabeled products, they can have some other medication which can harm the life of baby also. So they have to be very careful, and they have to take only the safe medications which has been labeled given for urticaria in pregnancy.
Okay. And doctor, for a normal person, right? We have already spoken about pregnant ladies who are having urticaria. But now for a normal person, now what happens? Because people do understand that, okay, so it's due to an allergy, right? And they are also aware about few of the anti-allergens, etc., that's available in the chemist shop. Now, many times people will just go ask the chemist that, I'm having some allergy, give me these anti-allergies, and they'll have it, and that's it. Now, many times those anti-allergens could have those sedative effects, etc. But anyways, as a layman, we are not that bothered about the side effects. We'll just go buy the thing and treat ourselves. What is your take on self-medication for urticaria?
Okay. Self-medication at any point of time, it's not advisable by any doctor. But if they have like a severe symptom which they cannot tolerate, if they are not accessible to any nearby hospitals, to an extent, antihistamines given by the from the pharmacy or chemist shop they can get for a single episode. It's okay, but after taking their single dose of the treatment, they should at least try themselves to go to the nearby hospital and take treatment properly. Otherwise, the mostly the everybody knows the treatment basic medicines they have at home, so nothing. It won't create any side effects, big side effects, other than sedation, as you told. Other than that, they should always go to hospital, which is solely advised.
Right. So the priority should be to go and consult a doctor, a qualified dermatologist. But in case you're having some problem or time issues reaching to the doctor, then you can take those things, but just for one episode, not more than that. Don't make it a habit. And doctor, we have one more viewer with us, Shruti Nigam, asking, I have been diagnosed for chronic urticaria. I'm undergoing a treatment. I'm taking medicines for more than 1 year now. Itching has become a big problem for me. Is there a permanent cure for this?
See, this is what I have discussed you already. Um, the patient need not worry. They can have safe treatments are there. They can continue to take safe treatment from a qualified dermatologist. Eventually, they will be free from urticaria in due course of time. So they need not worry unless otherwise there is any severe issues are there.
Right. And doctor, many times patients with urticaria complain that, their urticaria get worse during night. So
True.
what's about that?
What happens is there is a circadian rhythm which is happening inside the body. Usually these allergy producing cells are more in the evening time. So only the symptoms varies according to that. And one more thing, usually the patient will be at work in the daytime. So the symptoms will be masked by the concentration of the patient will be concentrating on work or other thing. By the time they reach home, they will be like sensing more about the itching, and they will have a lot of itching when they reach home and when they are free. So these are the two possibilities. Why do they have itching in the evening times and night times?
Okay. And again, patients complain that they get very tired or fatigued, patient
Yeah.
who have urticaria. So why does that happen?
Because of all the constant thinking and because of the constant itching, their mental strength get lower, and because of that they will reach a level of that mental fatigue, which in turns into the physical fatigue. So because of that, the chronic urticaria patients, they will always be like complaining like that, and they will have poor quality of life, so they won't be interested in working or any other recreational activities too.
Right. Doctor, is there any dietary precautions or do's and don'ts for patients of urticaria?
Yeah, in some cases, in some patients, they will clearly say that after taking certain food, their urticaria gets like comes immediately or gets increased. In such a case, we would say us to avoid such foods. Otherwise, usually this peanuts and other nuts are the main cause of this food-induced urticaria. In such case, we will ask the patient to avoid. Otherwise, there is no dietary restrictions.
Okay. And many a times what people do, because again, things are so easily available these days, they'll just go to the lab, even before, consulting a doctor, they'll go to a lab by themselves and do their allergy test, and they'll find out
Yeah.
that, okay, I'm allergic to 30 food items, and they'll omit those 30 food items from their regular, eating habits. Now, what's your take or what's your advice on that?
Okay. Usually what happens is those allergy tests, to some extent, they can we can diagnose urticaria or food-induced urticaria from that. Mostly, if you look at the items in the list, and if you you are trying to avoid, you can't eat anything. So I would say is, if the patient is noticing clearly that they are having urticaria after eating a certain item, that they can avoid. Otherwise, it's okay to eat anything they want.
So we have Ishita Jha with us, who's asking, what is the best treatment of resistant chronic urticaria to antihistamines and antileukotrienes?
Okay. If the patient is not responding to antihistamines or antileukotrienes, then we can give, if they are having severe acute urticaria, we can give a short course of steroids. Apart from that, then again, if they are not responding and still having chronic urticaria, not responding to the drugs which they have mentioned, then there is a biological drug which is called as omalizumab is there, which is very much effective in treating chronic resistant urticaria cases. And we have cyclosporin, and we have a lot of new drugs which are there. We can treat it with that.
Okay. And doctor, what happens, especially in case of anything related to our skin or scalp, what we normally do is go and search for a quick fix or a, home remedy which will cure it. Now, I'm sure with urticaria, people also try to do some home remedies and they'll just run inside their kitchen. Now, we all have aloe vera plants, etc. at our place. They'll take out the jelly, apply it, or some other, home remedies. What's your take on home remedies?
Okay. Home remedies, only few home remedies work in such, that too in certain skin condition. Regarding urticaria, what you had told, aloe vera gel is there and coconut oil. In on urticaria lesions, if they apply these two items, it can soothe the skin to some extent. Otherwise, it won't reduce the allergy producing cells or anything. Just a temporary relief it can give if they apply any aloe vera gel or coconut oil. Apart from that, it is not advisable to use any other home remedies for urticaria, and nothing such there. It is there that it is proven that it's effective. So
Right. So
people should
nothing is
follow.
going to work. It's just that it can soothe, few things like coconut oil or aloe vera can soothe the thing. And doctor, many times what happens, like for example, I'm having this, arterial condition right now, and I'm not being able to go and consult the doctor right away. I may, be able to go next day or so. Now, for that timing, what can I do?
Actually, if you are facing first episode of urticaria, then without any, you can't take self medication on your own. In such case, you have to go and meet the doctor. If you are not able to meet the doctor, then you can apply this aloe vera gel or even a calamine lotion. In everybody's house, it will be there. It can also be used to settle down the lesions for some time. After that, if the patient is having chronic urticaria, they would be readily having their tablets at home. So what I would always advise my patient is to have extra strip of antihistamines or anti-allergic medications at their home. If they can't come to hospital immediately, or if they are having urticaria at night, I would ask them to pop up tablet initially, and to control that episode and come back to us next morning.
Right. And doctor, with skin allergies, we normally have this notion in our head that we'll also get it from a person if we are in, close contacts, etc., or we share the things like towels, etc. Now, my question is urticaria contagious?
No, it is not contagious. And people of same family may have may have this lesion urticaria because of their genetic predisposition, not because that it is contagious. So you need not worry. You can if you touch or like if you talk to patients with urticaria, nothing is going to happen. You can be with them.
Right. And many times, in last 2.5 years, we have many patients coming and saying that, they had COVID and they also had hives on their faces or their body. Or after having those hives, when they went for the treatment, etc., they got to know that they are COVID positive. So many cases came up in last 2.5 years. So is there a correlation between COVID and hives?
Actually, there is no such like proper correlation. Any infection can trigger hives. So in such a case, COVID virus is also a like virus, respiratory virus, which can produce hives. It is not that COVID in any virus in any case can trigger hives.
Okay. I'll take one more question. Aditya Jain is asking, ma'am, which molecules you prefer in chronic idiopathic urticaria and which is fast acting?
Okay, I am usually in my practice, I prefer as an initial therapy, I prefer non-sedating second generation antihistamines as the initial treatment. If they are not responding, I would go for either cyclosporin or omalizumab. If they are having an acute episode of urticaria, then I would go for a short course of steroids.
Right. And doctor, when a person comes to you who are having these, urticarial rashes, now what lab test do you normally suggest? Are the lab tests needed, or just the, investigation is what you do? What you do as a doctor?
Okay. In the case of chronic urticaria, before labeling them as chronic spontaneous urticaria, I told you, no, without any cause, we have to run all the tests to know that they don't have any issues. So I would go for basic investigations like their blood count, liver function, kidney function, everything is normal or not. Then I would go for their this serum IgE levels and eosinophil count, which are the main allergy producing cells. And I would go for other tests like thyroid, have their thyroid levels to know that everything is normal or not. If they are normal, then I would label them as chronic spontaneous urticaria. If there is any cause, then we would treat them.
Okay. Vijay Kumar is asking, what should be the focus of the physical exam for urticaria?
Okay. Physical examination, nothing is there very like a specific examination we have to do to see urticaria. It's a very easy diagnosis to make. Just we have to notice like other places, like I told you, face and lips, whether they are having associated angioedema is there. In such case, their prognosis will be little bit what to say bad compared to the patients who are having only urticaria. And apart from that, usually we elicit a sign on physical examination called as dermographism, if to confirm whether the patient is suffering from urticaria. Apart from that, nothing is there.
Right.
And we also do a scoring of how severe it is, the urticaria, how severe it is.
Okay. Now, doctor, because there are one set of person who knows that they are allergic to something, maybe a food item or the medication, etc. So whenever they have urticaria, they understand that okay, I did wrong. I had eggs and I'm allergic to eggs or whatever. So they are conscious about it. But then there is one set of person who never had allergy to anything, but now they are having urticaria and they are trying to figure out what is causing urticaria, because they don't know that when they'll go and land up in front of a doctor, they'll ask that, what you did. So is there a way that they can keep a track of what could have gone, against them, or keeping a diary or something? Is there a way that you suggest normally?
Yeah, usually what I say is if you are eating out, just notice like what are the food items you are eating as a like new food you are trying, all that. So with that, they can keep track of their food items if they start to have urticaria. Otherwise, urticaria it's like an autoimmune disease only. It can start from any point of their life because of food also. Even if they are not allergic to previously, they can get allergic, they can get urticaria because of particular food at any point of their life.
Right. And doctor, before we wind up, any take home message for our viewers?
Okay, so for people suffering from urticaria, I would always say that don't expect like you will get cure in few months, or like nobody knows exactly what is going on in your body, and it is not like very much. It is not essential to stress yourself. Like when are you going to get out of urticaria? Just you have to take proper treatment, and you will be free from the disease in due course of time. Nothing to worry and nothing to like do with the mental health or your happiness. Just you have to
Right.
take proper medications, and you can live normally. No, no.
Exactly. So no need to panic, even no need to suffer in silence. Just go and seek advice and take the treatment. And one more thing, because you just pointed out, that the treatment may take longer. Now, what happens, especially in case of chronic urticaria, patient will just, go through the treatment. Now, maybe after 3 months or 4 months, the patient is able to see that, okay, I'm getting relief and I'm not having this, urticarial conditions bothering me anymore, and they will just go and stop the medication all by themselves, though they don't even consult with their doctor, etc. They'll just stop the medication. Then after maybe 2 3 months, they'll again start having the problem, and again they'll go with the prescription, get the medicine, and start it all by themselves. I'm sure you must have came across people who do such things. What's your take on that? Is it okay to do, or we need to
No,
stick
no.
to what the doctor is saying?
No, I would always say that if they are going to stop abruptly, the urticaria is going to come back in like after few weeks of time. So we should always like lower the dose of the medicines and to a small like minimum possible dose. Then only we can stop it. So I would always advise the patient, even if they are not having urticaria, they should come for follow up with us, and we have to stop the medications by seeing their response. So always go back to your doctor before stopping the medications.
Right. So going to the right person, which is a qualified dermatologist, is one thing, and trusting your doctor is equally important. So please trust your doctor, have faith in the doctor, and go by what your doctor is advising you. Thank you so very much, Dr. Priyadarshini, for your valuable time, ma'am. It was a very informative session for our viewers, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case they get to see such symptoms, they now know that instead of self-medication or home remedies, etc., it's always better to approach a nearby dermatologist. It was wonderful hearing you. Thank you so very much once
Thank
again.
you so much. Thank you.
And we really look forward for many more such sessions in the coming times with you for our viewers.
Okay, thank you. Thank you so much.
And viewers, thank you for your active participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page, all about skin allergy. We are also available on YouTube, Twitter, and Instagram. Thank you. Goodbye.